my first case study for Equine CranioSacral Therapy Certification. Today we have Libby. He is a Missouri Foxtrotter and is 22 years old. Libby has been a pleasure horse all of his life, and the owner is very concerned about him being trippy, and so his balance is an issue. Libby is grain-free in his diet, but he has no digestive issues. And so I chose Libby for my craniosacral case study because of his balance issues. And Robin will be assisting me in doing the gait evaluation, and then after that I will do check his vitals, and then palpitation and joint assessment into the craniosacral session. Right. Thank you, Mr. Robin. You can walk first, and then trot. So I see Libby's a little bouncy. He's getting ready to poop. Good digestion. A little stiff on the left upper leg. Yes, and now you can do a trot for me. Yeah, I can see his back legs are a little trippy in the back, how he's landing on his tippy toes and stiff in the hind end. And you can trot to the other side. Kind of not tracking up on that left side. Alrighty. And now we will start the vital evaluation. So you can hook him up. I'll move the camera. Thank you, Robin.
Welcome.
Move this over here. Okay. Stethoscope. Thought I said that right. Okay. First, I'll check his heart rate. So that's 35 beats per minute. And I did hear some gut sounds while I was checking his heart rate. Now I'll check respiration. So 21 breaths per minute. And I did hear gurgling, so his digestion, gut sounds are good. Good gut sounds. Now I will check his hydration. A little dehydrated slightly. It bounces back, but not quickly. So he could stand for a little more hydration. All right, now I'll check his capillary refill and his gums. Good boy. Can I check your teeth? Pink gums, good. About 2-second capillary refill. And now I will start the palpitation evaluation or assessment. Take this off. Take the stethoscope off. Tension in the TMJ area. Parietal. Little tension here in the axis, atlas, occiput. Tension in the rectus capitis. Splenius, cervicus, little tension in the brachiocephalic. Oh, got a reaction too when I'm here. The omohyoid. Tension here in the withers, spinalis dorsi, the traps, trapezius and rhomboids. Tension and the supraspinatus and infraspinatus. Cover the scapula. Little tension in the triceps and here. Tension here in that flexor. Extensor is not much tension. He does work that flexor more. Thoracic serratus isn't too bad. Check the pecs. Little tension here in the pecs and the external obliques. These pecs aren't too bad. Aren't too tight. On to the longissimus. Not too bad. But yeah, there's a lot of fossil restrictions here on the traps and rhomboids, like I said. Not much reaction in the ribs and intercostals. Still hear the gut sounds. Tension here and the gluteus muscle. The little fascial restriction. Tension here. Got a little wiggling of the lower lip. Tensor fascia lata, fascial restriction here, and the biceps femoris. Lip movement here. The adductors. Hey, Libby, good boy. Radial flexors. Oh yeah. Tension in the gastroc. Extensors. Little fascial restriction here and the semitendinosus. Slight, more like here is a little fascial restriction a lot internally. That inner thigh, like the gracilis area. Got some licking and chewing here. Lumbar, sacrum, little tension and fascia restriction there. Now I will turn him on the other side and check the right side. It's easier to move him than the camera. Might have to move the camera to that other side.
Butt out.
All right. Tension in this nasal bone. Tension in the TMJ, in the maxilla. More tension in this maxilla. And then on the left side, and occiput. Splenius, cervicus, rectus capitis. Tension here. Tension there, and a reaction as well. Tension in the pecs on this right side. Sensors, well-developed flexors. Tension and slight reaction here. The trapezius muscles and the rhomboids. Got a reaction here. Infraspinatus and supraspinatus muscles. The top, not too bad lower when we get to the triceps. much tension there. There's tension here, the spinalis dorsi, right this area. Longissimus, not as tight on the right than on the left, so there is an imbalance there. Get a dip on this side in that longissimus area. Got some shaking. Itchy, itchy. And now the intercostals and the ribs. Right there. Is that a spot? Thank you for letting me know, Libby. Got a reaction here. Intercostals, iliocostalis. Lower. Tension here. A little fascial restriction in those external obliques and some reaction as well. What's going on here? Umbilicus is tight. Yeah. Tension in the abdomen. Still hear the gut sounds. Adductors, it's tight all the way here in the adductor muscles. And the gracilis. Gluteus, maximus, medius. Tensor fascia lata on this side has fascial restriction. Very tight and deep fascial restrictions here in the biceps femoris on this right side. Tension and fascial restrictions in the sacrum, semi-tendinosis and membranosis on this side is really tight. Yeah. Fascial restrictions here and tension down that vastus lateralis. Rectus femoris, biceps. This whole side is tight. Tension. The gastroc. And the flexors. And the extensors. Tension all here. Tail. He allows me to lift the tail though. There's no tension or gripping of the tail. A little more restriction on the left side than the right. Real inflammation. He does hold the tail a little to the right side more than the left. And a little, some sores on the top of the tail. It's been a lot of scratching and itching. And the tail seems really coarse. So there's a little inflammation in the top part as well, and irritation, more so then lower. Yeah, it's a little inflammation from the top to about right here. Okay. So now we'll do the assessment of the joints. Libby's like, which way do you want me? We're gonna do that to the side. Let me grab some treats so I can check the TMJ. Brought some carrots. Finally. Make sure that this is long enough. What you've been waiting for, Libby. Can you go down? Okay. Good flexion in the neck. Lower. Let's go this way. Oh, oops. Neck flexion, lateral flexion. Let me get over here. Look right here. Good, lateral flexion to the right. Let me get one more carrot to check. Lower. Okay, not too bad there. TMJs while you're munching. Tension on the right side than the left. It's a little tight there. Now check the occiput. There's tension there in the atlas. That top C2. Here, there's tension. Is that C4, C4? Yeah, C5 and C6. C6 is really tight. Yeah, you still smell them. Oh, let me see that. Oh yeah, tension here in C7. There's no bounce. Check the scapula, tension here. Restriction of that shoulder joint. Got a pop. There's a little restriction in the knee area as well. A little resistance in the elbow too. Let's check the fetlock. Not bad movement in the fetlock, just a little resistance. Yeah. Let's see if you can stretch this out. How's that stretch? Good, good. Got some licking and chewing. That wasn't 4 carat. Got a response here. Let's check the withers. Tension in the withers, the upper. And the more I compress it, the less tense it gets. It definitely needs some work. Check the thoracic vertebrae. Got some resistance there. I think he's gonna use the rest. Got gas. So got a good reaction here, definitely, in the thoracic vertebrae. Check the rib heads. Tension here, and that's probably the T10 area. Yeah. All the way. Got a reaction. Intercostals. Check the lumbar. Sacrum. Tension in the sacrum. Check the hip. Up. Got a little cracking too, lifting that leg. Fetlock. Better movement, the fetlock here. Little resistance in moving that forward. Remember that I need to check the sternum. Square you up. Perfect. More development on this right side than the left in the pecs. Let's see. A little more on this side of the sternum than the left. Now let's check the SI joint. A little more developed on this side. And the right, more tension, fascial tension. Oh, I got a little reaction from him palpating here, SI joint. Okay. And now the other side. TMJ on this side. Tension on this right side. Tension in the atlas. Take the occiput. A little tension in the occiput. But more so up top of the atlas. Check the vertebrae. Got a reaction down here. I think that's like C4. Like a little bulge. Reaction in C6. Oh. Like this little elbow is protruding a little more than the other side. Now look back. Up. Limited range of motion in the knee. Good movement in the fetlock. Little tension when flexing, but not too bad. Oh yeah, tension here in the scapula for sure. Shoulder joint, a little restricted. Moving it back. Same thing with the elbow. And resistance. See, can you stretch? Can you stretch? Can you stretch that scapula? Little resistance and hesitation. But he does allow it. Good boy, good boy. Check the withers. No more. Yeah. Tension here, withers, especially in this area of the traps and the rhomboids. Less sensitivity on this side, in the thoracic. Tension here, and there's like a slight bump and a reaction too. All right. Got some licking and chewing. Whoa. heads. Got some gas. There's tension here in these rib heads. More so, yeah. Tension here, reaction here. Check the hip joints. Got some reaction here when palpating. Up. Good boy, Libby. Good boy. Too bad. We'll move it along this side, then the other. Yeah. Better movement. Show me how you do the fetlock. Better movement of the fetlock. Stretch. And when I stretch, his adductors go out. Good boy. Good boy. So it's like an external rotation. So now I will start the CranioSacral Therapy treatment. First, I will do an assessment of his asymmetry of his face. I have to take my glasses off so I can see. Gotta check your ears with your hair's in the way. All right. So this right side is a little higher. Eyes are a little higher, so it's like a not symmetrical. It's like there's tension on this left side. Good. A little inflammation on the nose on this side as well. Right. So I'm just going to tap into his craniosacral rhythm and connect with them. So yeah, there's like a left tension on the left side. Like I was pulled to that, actually the right side, where I am, his left side. Got some licking and chewing. Chewing. So I'm going to move on. Got a pop too. That was like going to reaction when I'm working on the C3, C4 area of his neck. There. I'll turn him back. Licking and chewing. Shaking thoracic. Got some shaking. Good. Good. We'll just let you process that. When I'm not even touching the withers. A lot of heat in the pec area. His eyes were starting to soften up, and then he saw something. licking and chewing. Mm-hmm. You may have to poop. You don't know what to do you? I'll turn it. A lot of heat in my lower hand. Where that thoracic serratus is. The lumbar, a lot of reaction. Feels like an unwinding, like a twisting, especially on my top hand where L4 is, and a lot of heat where the umbilicus. You know, maybe some saddle issues. Got some licking and chewing. Now the sacrum. Got a reaction when I place my hand in front of the sheath. Cerebral spinal fluid or craniosacral rhythm on the left side. And very depleted on the right side, but no movement at all on the left. Whatever you need to do, Libby, go for it. That's a release. Are you showing me? Yeah. Right there. Right there in the adductor. He showed me where he wanted my hand, so I'll go there. And I'm being pulled right up to the gracilis. I know this isn't part of the 10-step protocol, but I'm just going to follow his lead. There's a lot of heat too. On both hands. I feel a lot of spreading in my top hand. And my bottom hand, where the adductors are, it's just still. It's at a significance detector. It's real quiet. Good boy. Stretching the right side too. Good, good. Let's go to the other side. We'll work on that other hip too. Move the camera.
The camera.
He's in a good position. All right. Shoulder. Oh yeah. Got a good yawn. Good release. Either I'm putting you to sleep or we're doing something good. Mm-hmm. Good boy. Right here. A lot of movement in this top hand too, like unwinding that spinalis dorsi. All right, we're getting there. We're going. Guess I've done the lumbar already. Let's get to the sacrum. Right. More gut sounds. Oh boy. A lot of unwinding again in the sacrum towards me on this right side. His eyes are starting to blink like he's relaxing and thinking. Increased breath. And the licking and chewing. I'm gonna get right under here like I did on this other side. I know it's not a part of the 10 step, but he was showing me this is what he wants. Adductor, gracilis. A lot of heat in my lower hand. Stifle area. Is that it? Heat and moisture. A lot of unwinding too. think we found something. There was a lot of tension and tightness in his pelvis when he was walking too. You gonna do something? 'Cause that's where I need to go next. Good boy.
Do we put it there?
It's fine.
Okay.
Just gonna put my hand right there. It's like my hand's getting sucked right up there at the base of the sacrum where the tail begins. And he's starting to breathe a little faster. A lot of heat, especially on the left side. It's like a lot of unwinding. Good boy. Felt like the rhythm was off and then it came back on a little. Oh, got some licking and chewing. So I'm gonna pick up these legs first. Well, I'll do the front. Let's see, let's start here since you rested that one. Oh, let's see. I'm just gonna hold it and let it unwind the way it needs to. Oh, you liked that, didn't you? He just picked his leg up for me. Since I'm over here, let's do this one. A little more resistance. little deeper. So let's do your ears. They're too sensitive? How about this one? So I'll do the back. Like that one. Good dural tooth flow. Yeah. We got licking and chewing. And for the adjustment, I'm going to do the lacquer. Put my hand right here. For the maxilla. We'll do the maxilla. I think he is done. So that concludes my video first case study for my craniosacral certification. Thank you.